Hi, my name's Elizabeth Blair. I'm the Yacht CAMHS team lead, and this is an introduction into Yacht CAMHS and how we work. What is Yacht CAMHS? We work with young people and their families where there's a mental health concern and are currently open to the Youth Offending Team or Yacht or the Youth Crime Prevention Service, YCP, under the Youth Justice Service. Referrals are expedited for the young people that we see. We work with young people from age 10 years to 18 years, 10 because it's a criminal age of responsibility for England and Wales. And we work in partnership with Yacht and YCP, as well as other agencies as needed. The young people that we work with are generally teenagers around the age of 14 to 16, and they're either working with Yacht because they've committed some kind of offence, which could be anything from assaulting somebody to gang activity to involved with drugs or stealing, or they could be working with youth crime prevention, which means they're at risk of offending. What is the team structure of Yacht CAMHS? There's me as the team lead, and then we have 2 registered nurses and an administrator. So each side of the county is split from north to south, 1 nurse covering each side of the county. So who we work with within Yacht? We work with YCP and YJS workers, also known as Yacht officers, restorative justice workers, education workers, probation and police officers, therapeutic wellbeing officers, also known as TWOs, and turnaround programme officers. What is the difference between Yacht CAMHS and CAMHS? Once referral is accepted, initial assessment is arranged within 2 weeks. We liaise directly with YJS staff and other agencies. Work is not open-ended, so should be to the end of the Yacht order. However, if we're partway through assessment or intervention, we will complete it. We follow the same referral guidance as the rest of CAMHS. For example, we would get a referral into our generic inbox, which would be our referral form from another professional, generally from Yacht, or we would get an email request from another team within CAMHS to have a look at a particular young person. We hold triage meetings on a weekly basis, and we review those referrals to make a decision as to whether we're able to work with them or whether we're the most appropriate service to work with that young person. We then decide whether to accept them, and if we do, then we notify the Youth Offending Service, and we would be then liaising with whichever worker within Yacht who's working with them. We would provide an initial assessment within 2 weeks, or it would be booked within 2 weeks, and at that point we then decide what further action to take, what intervention would be necessary, for example an ADHD assessment or some CBT work. How we work within the team. We triage our own referrals but do liaise with SPA in instances where a referral has been received for a young person who's open to Yacht. We offer mental health assessment and therapeutic work. We can pick up cases from CAMHS waitlist if the young person is open to YCP or Yacht. When requesting our input, please be clear about the plan and what you would like Yacht CAMHS to do. We are reliant on professional disciplines from other CAMHS such as psychiatry, and therefore will work jointly with other clinicians on individual cases. Once we've completed that assessment and that intervention, at that point we would make a decision as to whether we would close that referral or whether we need to draw on the services of another team within CAMHS, such as for work around trauma or maybe the ADHD clinic, when we're thinking about medication for a patient who's been diagnosed with ADHD. Work we're involved in. We support Yacht discharge plans and transition to adult services. We attend a variety of multi-agency meetings. We joint work with the Youth Justice Service, which helps us with engagement of young people that we work with. We provide consultation for youth justice staff, particularly the therapeutic wellbeing officers who we see monthly. And we attend high-risk strategy meetings and other child protection meetings. We routinely attend peer group supervision, and we consult with FCAMHS colleagues when there's a high level of risk. We routinely attend the harmful sexual behaviour and risk of serious harm peer group case discussion forums, and we routinely attend Youth Justice Service team meetings, and we offer workshops and training to youth justice colleagues. A success story for us would be when we've assessed a young person and completed any intervention that we thought was necessary, and this in turn has then resulted in a young person's behaviour improving, their outcomes improving, and the likelihood of further criminal activity decreasing. We only accept referrals for young people who are open to the Youth Justice Service, including youth crime prevention, where there is enough time for us to work with them. If they've been working with the police, this does not necessarily mean that they're open to the Youth Justice Service, so it's important to clarify this before referring to CAMHS. If your team is working with a young person who becomes open to Youth Justice Service and you'd like us to support, please be really clear with what support you would like us to provide. How to contact us. We have a team email inbox where you can reach us. Please do forward any questions or queries to that inbox, and our administrator monitors that and will pass any queries on to the relevant clinician. For any further information, please have a look at Hampshire CAMHS website.